For the health and safety of your baby, your physician may suggest medical interventions. Interventions can play an important role in your birth experience, so being educated about the types of interventions is an important step in your labor journey. IV fluids during labor are used for several purposes. The IV fluid rate may be increased during times of fetal distress. All Group B strep positive mothers are treated with antibiotics during labor, and the baby is observed for an extra time period, so expect a 48-hour stay. Induction of labor can be medically required due to high blood pressure, diabetes, ruptured membranes, or complications with the baby. If chosen by you and your provider, an elective induction requires you to be at least 39 weeks gestation. Induction options include cervical ripening, preparing the cervix for labor. Prostaglandins help to thin and soften the cervix. A cervical balloon. This is the mechanical dilation of the cervix. Stripping the membranes, nipple stimulation, membrane rupture or breaking the water. Pitocin is a synthetic form of oxytocin, which is what your body naturally produces to put you into labor. When you're having a Pitocin induction, you'll have IV fluids and the baby will be continuously monitored. Your nursing team will watch to ensure that the Pitocin is not producing too many contractions while also monitoring the baby to see how he or she is tolerating this process. Your provider will talk with you about these options and make sure you know the risks and benefits involved. There are ways your provider can assist in your vaginal delivery. These options will be discussed with you prior to delivery. Your doctor will make a decision based on your needs during the delivery. Episiotomy is a surgical cut that allows more room for the baby to be delivered. This is not a routine procedure. Your OB would discuss this with you prior to doing the procedure. Repairs to lacerations or tears that may occur naturally are sometimes needed. Your doctor will let you know if these repairs are needed. Forceps and vacuum extractors are instruments that might be used to assist with vaginal delivery. Fetal distress is one reason these instruments may be used. If your doctor gives you the option for delivery with forceps, you may see some bruising on the baby. It usually fades within 48 hours. With the vacuum extractor, you may see a little scalp swelling. This usually fades within 12 to 48 hours. Sometimes with both vacuuming extractor and with forceps, you incur some perineal tears that would need repairing. Maternal exhaustion is when a mom is too exhausted to push or just not able to push, which sometimes happens with an epidural. Your baby will be monitored throughout the labor and delivery process. External monitors can be portable or non-portable. With a portable monitor, you're able to get up and move around. The portable monitors have a range of about 300 feet. Keep this in mind as you move around during labor. Another external monitor used for high-risk patients is a wireless monitor. With the wireless monitor, you are confined to your room due to the signal strength, but you are able to move around and walk inside your room. Internal monitors include the ISE or FSC. Those terms stand for internal scalp electrode or fetal scalp electrode. These monitor the baby's heart and provide a direct measurement of what your baby's heart is doing. When we can't pick up your baby's heart rate with the external monitor, an internal monitor is used. Your water must be broken to use the internal monitoring. Along with internal monitoring, we can monitor contractions with a device called IUPC, which stands for Intrauterine Pressure Catheter. This monitor lets us know exactly what the strength of your contractions are, but this won't be used if an external monitor is effective. Before delivery, take some time to consider whether or not you will use pain medications. Options for pain relief include narcotic pain medicine or analgesic. IV medications take the edge off of pain but don't provide complete pain relief. With IV medications, you may feel sleepy, lightheaded, and maybe even a little euphoric. These are short-acting and usually last about 1 to 2 hours. A local anesthetic may be desired if you need repairs after delivery and you've chosen to go natural up to that point. A local anesthetic can be used to numb the skin or wherever the physician is going to be working. An epidural is available if you choose complete pain relief. You may still feel pain and touch, but you get a more complete pain block. This service is provided by anesthesia, and that department will maintain your epidural during the labor process. it's important to prioritize your health and the health of your baby. Don't hesitate to contact your healthcare provider if you have any questions or concerns. Your obstetrician gynecologist is committed to supporting you throughout your journey. To learn more about Forest General Hospital's Women and Children's Services, visit www.forestgeneral.org/women.